Hi, I'm Dr. Alan Mendelsohn from Eye Surgeons and Consultants in Hollywood, Florida. I've mentioned before that with glaucoma, what happens is when we are born, there's a portion in the eye that's like a faucet in a sink. Faucet turns on, and fluid's made inside the eye throughout our lifetime, pretty much at about 2.5 microliters per minute. And it's at that same constant rate throughout our entire lifetime. There's a second area in the eye, just like the drain in the sink. That drain area, though, actually is very similar to the sponge. Just as a sponge has some larger holes, some smaller holes, there are little holes where the fluid will drain through. But unfortunately, sometimes what will happen is those holes in the drain can get partially clogged or considerably clogged up. If that were to happen, the faucet keeps running at the same rate, but if the drain's getting partially clogged, the fluid accumulates in the eye. That accumulation of fluid causes an elevated pressure called intraocular pressure. Now, one very important thing to mention is that pressure reading, which is given in millimeters of mercury, without a doubt is very important. But that is not the total story. That's just one single component. So normally the pressure should be in the teens. Ideally, we love it if it's 14, 15, 16, 17, 18's good. Once it gets to be 20, 21, it's a worry, and then higher than that. So I mentioned again that pressure reading is not the whole story, several reasons. Reason number one is somebody could have a pressure of 23, 24, and the nerve in the back, the optic nerve, is healthy. So here's a model of the eye. The cornea is the clear dome over the eye. In the back of the eye, we have the crucial nerve called the optic nerve. If the nerve is healthy, even though the pressure is somewhat elevated, everything's in good shape. But on the other hand, there are some people whose pressures are 16, 17, and yet the nerve starts to deteriorate. We call that normal tension glaucoma, where the pressure, the tension of the eye is fine, and yet the eye is slipping. So that is not the whole story. I'll explain yet another reason why that single reading is not the be-all and end-all. I'll give you an example. So when the diagnosis of glaucoma is made, someone's put on drops. And we're going to talk about the eye drops in a moment. There are many different drops of many different families. So there have been studies that have been replicated where at clinics, in the very bottom of the bottle, there's a secret little recording device. That way every time somebody turns the bottle and tips it over to put the drop in, the recording device will register. So the patients explain, for example, these drops need to be used once a day. But then afterwards, when the patient comes for the next exam, they're asked by the technician, in the past 3 months, how many times did you take it? Rough guess about how many times did you miss? The interesting thing is, almost inevitably, the patient would say, hey, I had the drops every single day without fail. Or maybe I missed once in the 3 months. But with that device, when the bottle was returned, and the device was recorded, there were many patients who actually missed 10 times, 20 times, 40, 50 times during that 90-day period of time. So just that pressure reading, so then you'd say, well, if they missed that many times, the pressure must have been very high. And the answer is that's not what happened, because while they would miss many, many times, right before going in for the exam, the day before, and especially that day, they put in many drops, so the pressure when they came in was superb, and yet throughout that 90-day duration it wasn't good. So it's almost analogous to someone going to see the dentist and maybe not being as conscientious about brushing one's teeth and flossing, but immediately before going in for the appointment, brushing one's teeth 3 times in a row, flossing 3 times in a row, having everything look super duper, while meanwhile, over the course of months, maybe they weren't so conscientious. So that's why the pressure reading itself is helpful, but it doesn't give all the information. So that's why there's diagnostic testing. So now, what if someone does have glaucoma? There are many, many different types of eye drops from different families. One of the most commonly used family are drops that here the fluids being made pretty much 2.5 microliters per minute. What the drops will do is decrease the aqueous production. So basically turn the faucet partially off. Fluid still being made, but at a much slower rate. That way, even if the drain in the eye has been clogged up, the drain can keep up with things. There's another classification of eye drops that will help unclog the drain, almost like liquid Drano concept, where it helps unclog the drain. Most commonly using one type, I'm going to go ahead and close so we don't waste water, using one type of drop that decreases the aqueous production, or a second type of drop which helps unclog the drain, that will usually do the trick. There are some patients who need drops from both families, decreasing the production and unclogging the drain. More commonly, they come in combination drops, where they work on two mechanisms. And lastly, there are some other eye drops where two different ways to decrease the aqueous production, or two different ways to help unclog the drain. But again, it's more common to have both mechanisms, cutting the fluid produced and also unclogging the drain. In total, if you take patients on one type of drop or two types of drops, from my experience and that of most of my colleagues, well over 99% of our patients with glaucoma can be maintained beautifully where the optic nerve stays healthy. But again, so yes, pressure reading's important, but it's not the be-all and end-all. As other segments have explained, getting a peripheral field test is very important. The OCT analysis of the optic nerve is so very important. And then the annual picture of the optic nerve, so we have that comparison. The old saying, a picture's worth 1,000 words. But again, in summary, the medications, they're terrific. Very high frequency they work. Some work for one person, might not work for the second, and that's why sometimes it's like a chef in the kitchen, as the ophthalmologist will make changes as necessary just to keep everything stable. Thank you very much.